Hello and welcome to the CSR Universe's Leaders Talk segment. And I wish all my viewers a very happy Diwali in advance. So, talking about Diwali, we know that the essence of Diwali actually lies in this shlok, Tamso Ma Jyotirgamya, which means lead me from darkness to light. So, in fact, indeed, this is the time to dispel the sorrow, the poverty, and disease of the most underprivileged sections of the society and replace that with knowledge, wisdom, and prosperity. And to kindle this kind of light in the hearts and lives of the most disadvantaged communities, PVR Nest, which is a social arm of PVR Limited, is all set to launch a resourceful and a very creative urbanism concept. And during this, especially during this month of festivities, and I believe that this initiative stems from the organization's focus on the United Nations SDGs, is SDG number 11 especially, which aims at making cities safe, resilient, and sustainable for human settlements, especially for the marginalized communities. And today, I feel very proud, privileged, and honored to have with us thought leader and industry expert, Ms Deepa Menon, who is the founder head at at PVR Nest, to talk extensively about the Trust's sustainable urbanism projects and also its latest public health interventions and initiatives. Very, very warm welcome to you, Ms. Menon. Thank you so much for giving us this opportunity.
Thank you. Thank you so much, Ruchika, for calling me in to the CSR universe. It's a pleasure to talk to you.
Likewise, ma'am, and we look forward to an enlightening and very engaging conversation with you. So, to begin with, Ms. Menon, you have been with PVR Nest since its inception in 2006. So, what has been the core philosophy, the CSR core philosophy of PVR Nest? And akin to that, you have talked about the urbanism concept. So, I would want you to elaborate on that concept along with telling me what has been the philosophy of your organization and what initiatives in the past as well as in the current scenario, what are the initiatives that you have been rolling out?
Absolutely. I think you have already kind of pulled in a couple of questions, and I'll start basically with the first, information to, all the viewers on what is the core CSR philosophy of PVR Nest. And just to basically begin with, PVR Nest, of course, is as briefed by Ruchika, a registered foundation set up by PVR Limited, which is India's largest film exhibition company to undertake CSR initiatives, and we are clearly in alignment with the UN SDG goals. And we make sure that we do multidisciplinary partnerships to transform urban spaces and facilitate to make cities more livable for women, children, and the marginalized communities. So in this endeavor, we try and build sustainable society with really, really strong emphasis in the areas of education, poverty elevation, sanitation and safety, and of course, gender equality and environment. PVR, of course, is a progressive organization, and it's very important for me to share with you that as a film exhibition company in the world, we would probably be the only one which has a CSR arm, a CSR committee, a CSR program, and even before enforced, by the Indian CSR Act, which got enforced in 2013 as a testament to the way PVR looked at a social meluna, social connection. So just to kind of, give some background information about the organization's past initiatives, we started this program while we saw a lot of risk in the city with respect to the most disadvantaged child who's at the road, at the street, and we really wanted to work with them. So children at risk is actually one of our core program which we started way back to bring access to safe spaces to children who are at risk through our program by providing them access to safe spaces. Primary education was offered in these centers. Basic nutritional and program for their health and growth was built. And then over a period, these programs were run in association with the government, and there was a government name given to them called the Anchal Childscapes, which was established in many government schools across Delhi in association with the municipality. We also collaborated with the largest actually railway partner, the Indian Railways, to rehabilitate, children at risk at the railways. And became even bigger, way back in 2014-15, when we picked up many child-friendly railway stations through the Childscapes program to rehabilitate and rescue 24 by 7 by creating the, child help desk and supporting the Indian Railways personals to make sure that the station remains safer for the children when they are, in transit and are in movement and are moving out from their homes, and the various, programs and process which were established by us. And then the second program, which actually came by kind of by default, because the government started observing the lot of inclusion initiatives which we were creating for children at risk program under Childscapes, that they realized that the Safe Center is an initiative they would really like PVR Nest to take over, to transform urban spaces and facilities to make safe spaces for women, especially the marginalized women. We were asked to actually start, the largest pink center kind of program in the city, which of course we got the license of 50 such locations, and we started looking at these centers in a complete program, programmatic way. Of course, the numbers pre-COVID were very, very big, but just to share with you that the entire COVID-19, we happened to get 5 lakh women users using these centers from 2021, 21, 22, and in fact, 21, 22 numbers are still awaited, which are going to be double to the kind of footfalls we would have got in these centers, which are run by 100 capable women who are upskilled to be pink leaders, running and making these centers safe for the city. So Ruchika, you also, wanted to know very specific information about, what is urbanism?
Right.
As
also, Deepa, I wanted to know what exactly were the issues and concerns that led PVR Nest, roll out this initiative.
Absolutely. So, so basically, just to share with you, let me just bring the context very, very clearly. Urbanization in India has really, really clearly become an inescapable ordeal for everyone. With respect to the development of any service sector, the population pressure on cities have escalated to another level. Cities really, really face a clear rapid urbanization because of overpopulation, acute shortage of housing and basic amenities, especially now clearly, now that you can't just say that a pollution is for privilege, but environmental pollution, unemployment, and social unrest is there.
Right.
So the model, we and constantly we've been working to see that how we can develop cities, because there is a lot of unplanned development, which is kind of creating a dichotomy which is prevailing in especially urban cities between the rich and poor and their facilities. While of course we all know that India has close to 70 million people who are living in close to around 14 million slums and households across the country, we also realize that metropolis like Delhi has the most slums, close to around 7,000 slums, with more than 1 million households depending on these slums, and is considered to be the most filthiest, most unhygienic in the city. And that's been our core genesis of investment in such concept. We also realized that in the middle of COVID-19, which is the novel coronavirus disease, this entire misery has gone to another level for the poor. And Delhi, which is actually the 6th largest metropolis in the world, has now become the largest residency of slum with no basic resource for them. So just to share with you, the biggest concern the urban poor are facing is the dirty, stagnant water. And that's all towards diseases, clogged, narrow lanes, cramped houses for them. And of course, they live around the heaps of garbage, because most of our study, most of our surveys at the community clearly came up that in national capital, you would find this all over. Sanitary installments for the poor and the water supply has been extremely irregular for them. There is, of course, a constant financial insecurity to this population. Post 2020, but we can now be more relevant because the shutdown of economic activities have really pushed the poor further.
Right.
And that is actually our main concern area and our investment on the concepts of urbanism. So I thought that I could move into, sharing with you that how did we arrive to such concepts,
Right. Yeah.
And so as I mentioned to you that we are clearly an investor to the concept of urbanism because it would mean that there is a science and an art of making safe city, both as a product, also as a process. So what would that mean? So there are, two components. One is a physical element of making a city, and one is a non-physical way in which the cities are made. So the physical element is the one which you see, which is the public spaces, the buildings, the infrastructure system, largely actually which is canvassed by architects, landscapists, urban planners, urban designers, engineers, and contractors who make our city. And on the other side, you probably find, the non-physical, actors involved in it, which means activism, advocacy, policy by the government,
Right.
administration, which are the various domain to for various actors and anchors who actually become a part of these non-physical are the politicians, the bureaucrats, the government officers, and the development programs which are running, the civic leaders, and also the citizen groups. So we really wanted to mesh these disciplines together to generate a very inclusive and equitable and sustainable space, which we want to create through these concepts by integrating the physical and the non-physical aspect of urbanism. So just to basically share with you, that is what basically urbanism concept mean for us. And, our journey started way back after our very strong experience in developing pink centers because they were dilapidated, bad spaces, are hardly even used by the community, given to us way back, and we converted them as pink safe centers way back in 2017. With these all 5 years of experience, we collated a lot of data and also collated a lot of energies which we were setting up. And so our first urbanism concept is this Garima Griha, which we are launching this month in October 2022.
Okay.
And this is going to be the first urbanism concept multi-utility community complex, which is going to be really an access to the economically disadvantaged community to give them almost everything more than the space could offer. Of course, it's very clear that there is no breastfeeding space for a poor woman here in the city. So we provide that space over there. We have a baby care space over there. We also we have incorporated the menstrual hygiene management products. Of course, incinerators to make sure that we are environment friendly. We've realized through pink centers that changing rooms are very big part of the poor women while she's at work. She wants to change to a uniform, or she wants to basically move into another dress and outfit, or she just wants to come and change. Grooming corners, which probably she would not even have it at her home, can become part of these safe centers. And of course, the most important is bathing facilities, washing facilities for them. Along with that, we have also incorporated the skilling and the income generation initiatives and the common service center so that, we could get this urbanism concept, the Garima Griha, the entire SDG goal, the entire social impact, which we could create and maximize. So just for your information, this is going to be the first one in Delhi, which will be opened very soon. We have an excellent response from the government officials to come and do the opening. And while this is in Kirti Nagar Jawahar camp, which is actually the largest camp comprising of close to 50,000 families across this complex. And we are expecting, Ruchika, not less than 3,000 women and children using this complex every day, which would mean that we are going to create the largest social impact of 10 lakh families, communities, especially women and children, using these facilities so that they can get it what they really deserve to be part of the city's development.
That's an excellent example of democratizing access to actually urban living conditions. And my next question related to this would be, how have these marginalized communities, have they been receptive to your endeavors, and how have they been receptive? And what kind of, have you developed any specific engagement tools to engage with these communities and raise awareness among them?
Absolutely, such a brilliant question. And we have been working with our pink centers, and they became the hub of a pilot to these urbanism concept like Garima Griha, which is now the first in the city. And we are really expecting many more in different states. And I would really like to give you some vision for that in some time. But pink centers did partner with multidisciplinary organizations to create, tools, awareness, awareness with respect to their health, awareness with respect to their, to their nutrition, also with respect to these different services which we were offering.
Mhm.
We started training the women at ground to basically go and get into finding that which service is actually being picked up most by the women folks, especially the marginalized one. And we were really shocked that the sanitary facilities were equivalent to the other services which were offered over there. So which would mean that 50% of sanitary facilities were used, which means they would be using the sanitation and hygiene facilities. But at the same time, you would probably see a lot of them actually changing, a lot of them actually grooming, a lot of them actually using baby care services, and a lot of them actually moving into reading and other facilities which they were not able to access in their own community. For that, we really need to partner with many organizations who are skilled and expert in handling it. We
Mhm.
wanted to test this so that we could go back to the government to tell them that please don't call them toilet, call them safe centers, call them pink centers. Pink, of course, is a very stereotype color, which probably meant more meaning in a city, a metropolis like Delhi, where slums are there, and they really wanted, that urban design to be visible.
Mhm.
Otherwise, these concepts are now moving towards the new name, which we are working with the municipality called the Garima Griha, the Pride Centers.
Mhm.
And just to mention to you, we've tried different tools and different pilots with university students in the from the city who are, learning and understanding social and developmental issues, especially related of being equitable. And they found that pink centers are giving opportunities of safety and protections with the kind of numbers and footfalls we were getting. To get a close to around a 1 lakh women using last month, all the pink centers itself is a testimony that, I think almost everything worked in the center with respect to safety and protection parameters.
Mhm.
And they find these spaces more safe than even, the place where they work. And we have seen them actually spending more time having some sessions with them and being part of our various workshops which we would do to a certain set of community who were showing interest on on safety audit,
Mhm.
on making their spaces safe for walking down. They would come back with lots of information. And our team, which is running the center, were actually equally engaging
Mhm.
uh, with the user-friendly experience these centers are offering.
Mhm. So, we were talking about that you have a multidisciplinary approach when it comes to collaborating with agencies. And so I wanted to know what kind of collaboration are you seeking from different social sector stakeholders, and who have been your partners, especially in these initiatives? And what do you see
Right.
in terms of support from the government level also?
Correct. Ruchika, we are living in this very interconnected, interdependent world, especially after COVID-19. It's become clear that everything is interconnected, and we want to always and always partner with the most wisest and the empathetic partners. I mean, it's very easy said and done, but there is always a process which we follow because most of our projects are projects which we are setting up are large community projects, which are nation's pride and prestige in all sense. We are trying to look into safety and health as key. So it's important that we identify partners with those multidisciplinary approaches, bottom up outlook, not a top down approach, in terms of really understanding the unique challenges, because these are urban poor, and hence we require investors who are and partners who are interested in that community to be part and be inclusive and be finding equitable opportunities. So we really work on that. We invest a lot on each of these partners to understand that what are their interest level while they are combining their collective goals with this big large programs. We have identified government partners in our journey. We have identified private organizations in our journey, strong urban planners in our journey, unique NGOs, and of course, community members who really take care of running these large projects. Of course, all these partnerships would bring in shared resources, cost sharing planning so that the risk is not put in one partner. Investments also are set up in such way that not any partner feels burdened that is part of this grant, which is, of course, making just to basically share with you that the partnership with government also is on those lines. So just to basically give a more kind of, detailed information about the support we have received from the government bodies. We've received immense support and listening from the government to every time when we would go back to them about, how the women are accessing the center and why they are accessing our centers. And we have, started believing in our strengths and capacity on delivering projects. So as I was mentioning to you that while we were creating drop-in booths for children, for nutritional services and tutorial supports way back and before COVID-19, we were also invited by the NCPCR to make these pink centers run. So at a policy level, the NCPCR immediately saw the footfalls because of the high sanitary quality which the PVR Nest team was offering, through the women who were running the center. It was by women and for women. So these strategies were adopted to make sure that we are really making this open and welcome to everyone. And hence the numbers kind of are very big. And the interesting thing that, over these years, the government is trying to really work out with a unique arrangement with us, which of course I can't disclose it today, but in my next interview, I would be very happy to talk to you and your readers and viewers that how these centers are going to become sustainable and more and achievable for many other operators to pick up such concepts, which will give a way to a lot of organizations to come and be a part of this social impact. And the whole, the underlying, the reinforcement which we are doing is city planning, public health, intertwined with environmental, social, and technical support so that we are hand in hand towards the holistic vision for a healthy city. And that's what we are trying to approach while we are interacting with anyone here.
Wow, that's amazing. That's very inspiring. And is also slum redevelopment a part of this initiative? Are you also looking at that?
That's a very interesting question because all of these development are just at the backyard of the slum households. And I really want to touch upon, a very interesting note because I thought that it will interest you also. And it just to have to be very, very clear to all of us that we maybe, all of this has become very big to us for the last 2 years because our kids could not go to school. We could not go to work. Movies were not there in cinema halls. They were in OTT. Things were very different. But we are not strangers to the epidemic and the pandemic environment. The Black Death killed around, millions in the 14th century. There was increasing transportation, which created in 1800 the spread of disease across the globe. And, the swine flu, which killed more than 5 lakh people in 2009. And of course, Zika virus, everyone knows that actually was also one of the greatest, kind of disease at that year, 1516. So what is that we need to really understand is the connection which we are creating with our habitat and what we are now calling a disease, the local ones which are coming up. And what kind of instigated, strategies like the Pink Center, which we have opted for, PVR Nest, under the urbanism concept by creating such facilities to endure health crisis. The first vaccine we all know came really late to all of us. Meanwhile, we lost around 1.6 million, people. Even December 2020 tried to get the first vaccine, but none of us could get access to it. Then there was so what COVID-19 pandemic now has clearly given and revealed the ugly mess which is inside the homes of the poor in the slum. So simple things like washing hands and observing distancing is impossible in
Yeah.
the slums. And hence it's very, very important and need of the hour is to really, really create that security to that slum dweller. And that is what this center actually, Ruchika, offers. Access to safe and sanitized space. We can establish clinic. We can establish more clinics and healthcare facility here because these spaces are large. We are partnering with organization and local support bodies who have better and better relationship with communities so that health becomes city is only and only doing health projects, and we have to ensure that we are providing free vaccine, nutritional food security programs,
Uh-huh.
and, and making sure that we can actually rework, like you mentioned, that slum development, adequate slum development programs can also be initiated. But as I say to you, Garima Griha is as a big eye and a big vision for the slum, for the slum community, because this is going to be giving an opportunity for a large base of women and children to have access to this at one go.
Wow, wow. So, if we talk about PVR Nest, it has been determinedly focusing on rehabilitating women and children, particularly in the healthcare and education domain. So, what are your thoughts? Can you shed some light on the challenges, the current challenges, and the needs of these particular communities? And in terms of especially building a robust healthcare system, and what kind of interventions are you looking at? What is the need of the hour?
All right. So, the need of the hour, just for your information, the pandemic has really been, created a silver lining to all of us. And I'm just saying from a very privileged point of view, we all got to drive less. We all knew that, poor neighborhood or people who are living in buildings started spending more time in outdoors.
Hmm.
So the best part is that the silver lining is the awareness of personal and public hygiene, which has become, on the surge. And particularly, the health authorities are really, really advocating on hand washing and changing the habits. And these centers are actually going to promote, their personal, habits to convert into, so that the city and health project remains as at the core principle of these programs.
Hmm.
And especially, I feel that during post COVID-19, I'm hoping that the future, especially with the municipality and health departments, is to get more and more budget
Hmm.
and more investment for disease preparedness and the response to it. Because it's very clear now that we as communities are able to digitally interact,
Hmm. Hmm.
but that's kind of given us a lot of opportunity to be away from lot of issues which are there, like transportation issues or the pollution which we were creating. So the digital interactions are increasing with these collaborations now.
Hmm.
The environmental friendly practices are very, very critical,
Hmm.
and how we can actually pass by and make that as part of our life so that we actually pass this global pandemic safely, and create an impact. And India has actually created that impact in spite of so many challenges.
So, Deepa, you've spoken about the key learnings and challenges that pandemic had actually exposed to us, and you also talk about working very closely with the UN SDGs, of which environmental degradation or saving the environment is a very important part, and an environmental catastrophe is coming. So, what methodologies and what new technologies have you incorporated to change that scenario? And also, have you used the three R's, the reuse, recycle, and reduce approach in your initiatives?
Yes, absolutely. So you're so right that climate change challenge has really made us really rethink. And actually, you're right that just to share with you that why we are speaking to you is this concept is purely dedicated towards the climate change challenge, which the poor and the marginalized are facing, and this is a resultant to our long-standing commitment on such infrastructure to be part of community living and community life. And we've realized that, bringing Garima Griha right on the forefront in the city like Delhi will actually give us more opportunity to work in different states so that we can actually bring in a similar kind of, prototype and have more operators. And like I mentioned to you, our success in Delhi with the government will actually also give an opportunity for more operators to become collaborators in other states for us. So some of the methods and technologies which we would be really working, as these centers will open, would be to create, digital support and services to the poor and the marginalized, so that really they don't have to depend on, the long queues and the low literacy level they have in terms of, getting their rights out. So we have gone ahead and created in this center beyond the sanitary facilities, which I've been mentioning that are very big part of community living, is this, access to such technology interface in association with local NGOs and partners. We have also gone ahead and actually, try to get, skilling and income generation initiatives which are more meaningful to the community, so that they can start finding some more connect with these centers, not typically, which are only and only dedicated for their health, but also for their livelihood. So it's kind of picked up its learning, and as I told you, it's silver lining. The way Garima Griha has been conceived is only during the pandemic time we realized that when we were working with many organizations which were distributing vaccines, they were looking for such centers where we could collect the poor together. And as I was mentioning to you, I just shared some numbers to you which were quite phenomenal. I was mentioning to you there will be 1 million women members who will be using our centers next year when we open it in October. So you can understand that the kind of different programming we can do with respect to their health, with respect to using digital interface, or with respect to making sure that they are environmental intertwined with their health. Why, what would that mean? That, any waste which is coming out from these centers are also incinerated well, are also being reused well, are and also being taken care of. So we are partnering with organizations to make sure that if there is any plastic over there, how do we partner with the right meaningful organization? If there is a waste of incinerator over there, do we partner with the government with the right incinerator and right level of burning them off and going and making use of them back to the environment. So these partnerships are being worked with lots of organizations to make sure that we are building those strategies in the program to make sure that they are climate change friendly and is able to kind of at least not put the pressure on climate change, but is mitigating the challenge currently the community is facing in actually the waste and waste management.
Wow. Deepa, thank you so much. My last question to you would be what are your words of advice and suggestions to your peers who are working in this domain, slum redevelopment and urban planning, and providing sustainable urban settlements to everybody, especially the
Yeah,
marginalized sections.
absolutely. And I think, I think most of my friends and most of the organizations I'm connected with have been deeply involved and very clearly involved with, lots of programs. But it'll be nice to see that we provide more and more security to the poor, especially social security and security, to make sure that we are able to give them safe and sanitized spaces, as I was mentioning to you. It'll be great to basically see that we partner with many nonprofit organizations and local support bodies so that we are able to give the requirement which these communities require with respect to their health, with respect to their security, with respect to their education. And hence it's very important that all of us should be very mindful and thoughtful with respect to the current times for the communities, so that they are able to give the most from their grant and make it accessible for the communities for the near future.
Wow. Thank you so much. That is really inspiring and very thoughtful. And I think the organization is doing a commendable work. We wish you all the best for all your future endeavors, and all the best to the entire team of PVR Nest. And thank you so
Thank you
much for
so
giving
much.
this opportunity to us.
Same, and thank you so much, Ruchika. It's a pleasure to talk to you and to get me into talking to you. I'm so glad I invite you officially to the Garima Griha launch in the coming days. I look forward to see you over there.
Thank you so much. Thank you so much.